And I learned a lot from Dr. is on detoxification strategies using IV therapies, and really nobody else does detoxification, I'd say, the way Dr. Elias does with the IV. So I feel very, very lucky that I got to learn from him as well as Dr. Klinghardt. And then I really merged together what I learned from these two doctors' methodology with respect to detoxification and treatment for people who have all kinds of infections, including tick-borne illness in their
Welcome to the Peptides and Longevity podcast. Each week, we'll dive into groundbreaking science, innovative therapies, and the future of health and longevity. Alongside visionary physicians and experts, we'll explore how peptides, cutting-edge medicine, and lifestyle strategies can redefine the way we age. Get ready to transform your health, optimize your vitality, and unlock the secrets to a longer, healthier life. Let's get started.
Hello, this is Dr. Kent Holtorf with another episode. Today we have Nafysa Parpia, and she's going to be talking about peptide biohacking for complex illness. Very exciting. She treats the sick of the sick, the very complex, and recently she's even treating healthy people, which is nice. But I'd like to thank you so much for being on the summit, and looking forward to our chat, and I'm sure everyone's going to get a lot out of this interview. So thank you.
Thank you for having me. I'm honored.
Great. And I love her. She's always smiling and in a good mood and her passion. But yeah, so a little about Nafysa. She's an independent practice at Gordon Medical Associate in Santa Rosa. Specializes in the treatment of Lyme disease, other complex illnesses, autoimmunity, mold, fibromyalgia, environmental toxicity, gastrointestinal disorders. Our patients with chronic Lyme disease are typically those that do not do well with antibiotics. And as we mentioned, in our practice, we kind of switch from more and more antibiotics to immune modulation and peptides, and found we get from point A to point B much quicker. And so really prefers a biologic medicine approach to treatment, including combination. Antibiotics have their place, and detoxification. And I think more and more finding that, these patients don't detox. Over years treating these illnesses, she discovered the same methods used with essentially well people fostered increased vitality and slowing down the aging process, leading to include specialization, health optimization, and regenerative medicine. And that's what I mentioned. I find that there's such a commonality of aging and illness. And we looked at, we do tons of labs, and wow, the autistic people look just like the Lyme people, with this, with the older patients, just accelerated. So yeah, you look at patterns, and that's what you could do when you get a lot of good information. So she used a variety of modalities, including peptide therapies, oral and intravenous micronutrient therapy, botanical medicine, functional nutrition, injections, lifestyle counseling, craniosacral therapy, biochemical imbalances, energetic expression, how your genes respond to the environment. So that epigenetics, which is just huge, your genes are not your destiny. It's, what's turned on and what's turned off. Toxins play a part more and more. Exposure to infection, which we've talked about, but everyone's kind of touched on it, but no one's really dug really deep into that. And emotional imbalances. And stress is a killer for these illnesses. And it just really causes such immune dysfunction. And she really is a detective, and looks for the underlying condition instead of looking at the chart. Oh, you got this, put you in a little box, and then you get this medication. It just doesn't work. Standard medicine, I think, works well if you fit in a little box. If you break your arm, if you have strep throat, unless it happens after that. But once you're outside that box, it just breaks down, because they have all the specialists that look at everything separate, and you can't do that. So I love that. Really, trying to be a medical detective. We need more of that. She's really a sought after speaker at conferences. I see her all the time. Her and Eric Gordon running across the country, across the world. She's spoken on topics such as tick-borne illness, environmental medicine. She's spoken at ILADS, and they're very particular who they either let speak, environmental health symposium, and more, I think the environmental, they were kind of thought of as a fringe group, but so much data is coming in on that, And those guys, what I really like, I'm probably talking too much about it, but is that you go to certain ones like ILADS, environmental, they're doctors. They really want to be, again, detectives, and they're scientists. Where things like, other anti-aging groups, they kind of want to be cosmetics and things like that. And they don't want the tough patients. American Academy of Ozone Therapy, that's a great organization. Board member of the Neurohacker Collective. Awesome. So we're going to be talking about, again, biohacking. And she's been interviewed on their podcast, Collective Insight. So I kind of extended your bio and stuff a lot. So now now that we're done, but I mean, there's so much that we can talk about, and she has so much experience with some of the sickest patients. But yeah, tell me about yourself, your practice. What kind of patients do you see? How did you get into this? Just give us a little short summary of what got you into this.
Yeah, so I started around 10 years ago at Dr. Dietrich Klinghart's clinic, where I learned from him and his top physicians at the time about the patients who have complex chronic illness, particularly tick-borne illness, co-infections, and environmental toxicity. So I spent a year there, and then Dr. Isaac Elias invited me to be the lead Lyme doctor at his clinic in Santa Rosa. And I learned a lot from Dr. on detoxification strategies using IV therapies, and really nobody else does detoxification, I'd say, the way Dr. Elias does with the IV. So I feel very, very lucky that I got to learn from him as well as Dr. Klinghardt. And then I really merged together what I learned from these two doctors, created my own methodology with respect to detoxification and treatment for people who have all kinds of infections, including tick-borne illness in their.
Yeah, because I love, I mentioned, we were talking before we were on, that I went and did plasmapheresis at his place. Yeah. And I love plasmapheresis. It's just very hard to do in the United States. And I heard he wasn't really doing it anymore for sick patients, but I don't know.
I think he is doing it for sick patients still, actually.
Oh, yeah, you hear these things. So I ended up going to Puerto Vallarta. But we're looking into, there's a self-contained unit, which I'm excited about, which we're going to try to adopt if possible. But yeah, I mean, it makes sense, just cleaning out all these toxins and, and what, couple hours,
Yeah, it's pretty amazing, really.
Yeah, it's nice. He's a really nice guy too. And so you were there, and then you went over to Gordon Medical?
Yeah, and then I went over to Gordon Medical and work more with very sick people. Same patient base, complex chronic illness. So, of course, the tick-borne illness, mold, people who have a high level of environmental toxicants, people whose immune system is both hyperactive and suppressed at the same time.
Yeah. And you got exposed to a whole new set of amazing doctors there.
Yes.
So you've had a really nice ability to take, the best of all these doctors.
I really have. I've really loved working with Eric, Dr. Gordon, and Dr. Anderson, and
Eric's one of my favorite people. I love giving him the hassle. He's so fun, but just a good person. Yeah. So you still see a lot of these sick of the sick, and
absolutely.
And have you noticed that I think it's more than even just awareness. Like, more people are sick now.
Way more people are sick. I mean, our clinic is packed with people who are sick, who were not sick, say 5 years ago.
Yeah.
And they are now.
And it's like a little cocktail party, and I swear every person, it's either them, a family member, a friend, their parents or their kids. It's just, it's nuts.
And I'll tell you what I'm seeing more of. I'm seeing more of people from Silicon Valley, people who are at the top of their game, right? Mentally, physically, spiritually, they're really trying their best. All of a sudden, they don't feel as strong physically, or they don't feel as sharp mentally. And these are people who are mid-40s.
All right, so you're diving deep into peptides and longevity on this podcast, and we're right there with you. Integrative Peptides stands out, trusted by over 10,000 doctors to deliver real results for their patients. These premium peptides are your key to unlocking vitality, recovery, and a longer, stronger life. Visit integrativepeptides.com and use the code PODLIFE for 10% off your first order. Again, integrativepeptides.com. Use the code PODLIFE for 10% off. It's time to elevate your journey, starting now.
And they're kind of set up for it, type A, and all of a sudden they get, some sort of infection or toxin, or we had a big flood of people overtraining syndrome, so called the healthiest of the healthy, doing 10 marathons, all of a sudden, wham.
Yes.
They think about that.
More past 4 years of this population than I did.
Wow.
6 years ago, so it's.
Yeah. And again, I don't want to bash them, say them, I'm just saying what they're capable of. What do they do for you? They CBC Chem Panel, and they go here to you must be depressed, and they're told that. And I think, I'm sure you find this, and when you show them on paper all the things that are wrong, kind of go, I got good news, I got bad news. The bad news is you got this, 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 this. The good news, you got this, 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 this. When everyone told you, they don't know what it is. And so that's awesome. And it's one of those things, it's I think a lot of the doctors in this area, like I was very evidence-based, I still am very evidence-based, but it's ingrained in medical school. All that other so-called alternative, which I don't like that term, is no evidence. And so I wasn't getting help, and I go to these alternative conferences. I'm like, oh my God, they're more evidence-based than what we're being taught,
It's true.
Yeah, it's great.
And the clinical response, really, we don't have all of the research that I wish we had.
Yeah.
Where we don't really, there's so much clinical evidence.
And there's just so much evidence. And a lot of the really, doing research is that old research that just gets left behind because it's not a new drug. And I think one thing is that so many doctors rely on societal recommendations, right?
Yeah.
But when you look at levels of evidence, okay, like how strong, and this is big now with, vaccines. It's funny. I was on Fox News and mentioned I wouldn't give a kid H1N1 vaccine, which I was right. Only helped 12% of the people, and people got narcolepsy and demyelinating disease and the HPV vaccine. I mean, there's issues. Look, I'm not an anti-vaxxer. It's everything's risk benefit. And why can't you question even a vaccine? But now they can because it's Trump or whatever. It's funny, but they'll basically say, well, the society, the Peptide Society says this, Endocrine Society says this. Well, at the level of the World Health Organization, levels of evidence. So it's double-blind, placebo-controlled study. You got meta-analysis where they take a bunch of double-blind, put them together. Then you've got unblinded trials. Then you've got case studies or anecdotal. Last, the least, the lowest strength of evidence is societal recommendations. And that is below an anecdotal story. You say, I got this patient better when I gave him this supplement. They found that they're 20 years behind. They don't change their recommendations. They are not evidence-based. They have an agenda, and they go and basically do one side. And they found that they're almost always wrong. And 10 years later, they're shown to be wrong. But it's funny how we're called not evidence-based, and they're going by the worst evidence there is by saying, well, I just listen to the, whatever society did. But anyways, my soapbox there. But how did you get into peptides?
Well, As you know, Gordon Medical's on the cutting edge of medicine, always, of I almost said alternative medicine, but it's so much more than that. I call it functional medicine and beyond, right? So Eric is always bringing in what's new and what's on the cutting edge. Really, we got into it through you, and
Eric, I go way back.
Yeah, exactly.
I remember, fighting the establishment, and we opened 22 centers 20 years ago, fighting the Texas Medical Board for stuff that is standard now. And I was called a quack, and I'm like, here's 200 studies showing this. No, we don't like it, you know?
Yeah.
Yeah. I remember commiserating with Eric late at night.
Yeah.
Saying, is this worth it? You know, getting beat up over here. Yeah. That's great. So which ones did you kind of start using, or what would you recommend to a doctor or a patient, or, where do you start in general? And other patients different? Do you have a general type of system, or?
Yeah, I'll tell you, before I started using peptides, I would work with detoxification first, because that was my way of being able to shift an immune system that was dysregulated. There is research that shows that environmental toxicants, as well as infections, are going to cause immune dysregulation, where there's hyperactivity of the immune system and weakness at the same time, right? So when I use detoxification therapies with IVs and treated mast cells, I would see the immune system beginning to shift. The patients were actually able to mount an appropriate immune response to kill off infections. They needed less IV antibiotic therapy or less oxidative IV therapies. But now peptides, enter peptides, right? And what I love about the peptides is that they can modulate the immune system specifically and quickly. And so now it means that I can detoxify my patients in a shorter amount of time, because their immune system is going to be able to, it starts to rebalance before I have to detox for too long before I can come in and kill infections. So it really shortens the amount of time between detoxification and killing, getting that balance.
Yeah. It's kind of cheating. I'll take it.
It is that. It's like, boom, now I have something that's specific.
Yeah. And the nice thing is the safety profile too, Yeah. And it's very rare to get a side effect, and especially anything serious. And so which ones do you like?
So I'll use BPC-157 and TB4 first, because those ones will modulate the immune system, and then once they've been on that for a couple months, while I'm using antibiotics if I have to, or other oxidative therapies, and while I'm detoxifying and treating mast cell activation syndrome, like I said before, that shortens using the BPC and the TB.
Right? The BPC is definitely how you get. And, I think you're on the Mast Cell Mastermind group, some of the smartest people in Africa right now. I mean, he has, 3-page answers to everyone's, but just amazing man. But they're kind of stuck on direct going after the mast cell. And look upstream and you look at like CRH, prototypical releasing hormone, huge stimulator of mast cells. And the autonomic nervous system and sympathetic nervous system, basically stimulate mast cells. So if you can modulate that, you got half your, job done for you.
Exactly.
And then the thing is that with TB4, so full-length TB4, it has multiple domains. One, there's a domain that grows hair. There's a domain that modulates the immune system and antifibrotic, it is anti-inflammatory. Then there's actually a domain that stimulates mast cells, right? So, and we just did an interview with a person. Oh, it's interesting. And it was wiggly that he has to go really slow with the full-length TB4, but she used the TB4 frag, which has the mast cell part taken out, and she said she can go much faster, and she didn't know that because that part's taken out. So it's really interesting stuff, and I think the nice thing is the peptides go with everything. I don't know anything that they don't go with,
Oh,
and they're really synergistically with each other. And it sounds like you like the oxidative therapy as well. Ozone, yeah, our go-to is BPC, TB4, ozone, kind of a mainstay. And then you've got, other things which are almost kind of second out. Yeah, throw some LDN there. That's not going to hurt anyone. And you never know what's, some simple things. Oh my God, my life's changed, and well, other people, it's nothing. Yeah,
Exactly. I mean, for example, a patient I've been treating for, the past few years, high dose vitamin C, IVs, ozone, everything you just mentioned, LDN, all of it, including the detoxification therapies with the IVs, and we're moving along, and it's great. Then I give her TB4 and BPC-157, and she comes in 1 week later, and says, I don't know what happened, but I am myself again, like in my 30s. This woman is 60, and I don't know what you gave me, what's in there, but nothing has shifted me so quickly. I'm on a whole new page with her.
But see what you did for that person's life.
Amazing.
Yeah, and I know it's kind of like it happens all the time. Where, yeah, right, yeah, I know, but it's like because it happens all the time. Well, what other peptide do you like?
So I also like TA1. That one add in after using the BPC and the TB4, because then we're going to kick up their response in killing off.
Yeah, so you're going to stimulate. But yeah, if you use it too soon, it can cause a Herxheimer and all that. Yeah, so what other peptides do you like?
I like 37. I noticed that's going to that does just disrupt the cell wall of the infections, and of course it weakens the infections. So then when I do come in with anti-infective therapies, that goes faster as well. So,
yeah, and it pokes a hole in their cell membrane, so immune modulatory as well. I was talking to a urologist who doesn't really, he's a standard urologist, but someone told him about LL37, and he's like, I have all these chronic prostatitis patients that I was just treating years with, Levaquin, and significant side effects and Bactrim, and now I have that with 2 weeks of antibiotics, and they're better. And their PSA comes down, so they don't need a biopsy now, and yeah, so people are finding, yeah.
I'm noticing these peptides are shortening the duration of treatment all around.
Nice. What detoxes do you like? What's your approach to detox?
So I am supporting the organs of elimination, so the liver, the kidneys, the gut, the skin, with herbs and with IV therapies. So using phosphatidylcholine as an IV, or
I love phosphatidylcholine.
Yeah. And amino acids and minerals as the cofactors for their detoxification system. Of course, glutathione, chelation therapy. So I measure their environmental toxicants on the labs, and from there decide where we're going to start with detoxification. Also depending on their sensitivity, I'm always going to want to have a binder on board, of course, right, to make sure that they are flushing out those toxins.
And I'm a little ADD to use binders too much, Okay, we've done that for years, and it binds everything else, and but yeah, and shoemakers work.
Yeah.
I don't say anything. Yeah, I mean, I think phosphatidylcholine is, to me, better than chelation for heavy metals. I love that stuff, and it's interesting. I have a center, I can't even have time to do ozone, but a couple of days ago I was able to do ozone, phosphatidylcholine, throw some stem cells in there.
Yeah.
Are you stem cells at all, or?
We are an exosome.
Yeah. And I think those are another tool, and they, and the peptides actually, stimulate the stem cells, and then they'll also secrete peptides such as LL37. And so everything is kind of, either a good cycle or a vicious cycle that goes bad. So that's interesting. So timing is always key, and when you use these things. And so I think that comes in with the art, right? It's like, having treated so many patients that you kind of get a feel. And I could almost, I think, like do pretty close to, like, I like getting tons of labs. But if I did none, I'd probably do pretty close, I think. But I think a big part is convincing the patient what they have. And that's where we're like, look at the immune system and look at their natural killer cell function and their, it could be a C4A and human growth factor beta. When those are abnormal, now you can tell, hey, look, there's something going on. Let's find out what it is.
Exactly.
And because it's a tough pill to swallow, where we're getting a lot more done through their insurance, labs, and then try to minimize the specialty tests. But, I love when I have the luxury of getting those. Which specialty tests do you find kind of bang for your buck?
So did you just say specialty tests?
Yeah, whatever it may be, gut, genetics,
I love
testing, or whatever it may be.
Yeah. So Lyme testing right now, we're using a lot of Infecto Lab.
I have their folder. I really like them. They came out, and I don't see that many new patients. I keep meaning to give a presentation to all the doctors on it, but I liked what I saw.
I'm using it a lot because they're able to give specificity of what infection is active right now in the patient in a way that other tests aren't able to do. They're looking at interferon gamma and interleukin-2 with respect to the tick-borne infections and also CMV and EBV. And I mean, usually we can tell because we've seen so many of these patients. We're able to tell what infections they have based on their symptomology, but you
have to show it because they're going to go to their doctor, their friends, and they're, how many times have I heard that, they go to their doctor, there's no Lyme in California. And this one guy almost bit my head off, and he was so much better. We treated him for Lyme, but his doctor said, this is ridiculous. There's no Lyme in California. He calls, like, just screaming at me. And then I'm like, no, and so the lab's like, okay, we either have 35 separate illnesses or it's, one common thing. So kind of calmed him down. He goes, I'm feeling better, but my doctor said there's no way this is true. And then 2 weeks later, his dog gets really sick, brings the vet. Oh, the dog's got Lyme.
There you go.
Yeah. So it's pretty. You use it all the newer test. It looks at the Borrelia bacteriophage.
I haven't used that one.
Yeah. So it's just new out, but which is bacteriophage is a virus against a bacteria now, and they're being used in Europe and things instead of antibiotics. So they're very specific, and they don't just kill everything. Yeah. But there's no what's called a lytic phage that kills Borrelia. See, it always is like special, right? Yeah. There's just what's called lysogenic phage that it hangs around. So when you look at we talk about like the microbiome, we're more bacteria DNA than we are human DNA, but there's 100 times more viral DNA than there is bacterial DNA. So it's really our next thing we're going to try to understand is the microbiome. And it's really interesting how, reading studies where how they just interact. And if like one cell's study on, you have like good bacteria making butyrate, right? That's really good for your body. But if the level gets too high, it turns on the bacteriophage and starts killing that bacteria. Like, it's just like the Matrix or something, It's so incredible. So, and I think it's one of those things, the more you learn, the more you realize you don't. And I think the doctors that know the least are the more adamant they're right. But so those are your three favorite peptides?
Those are my three favorite peptides.
Cool. And you make some for localized pain, or you do for pain?
I do. So of course these patients have a lot of pain, a lot. And of course it is systemic pain they have, but in addition to that, there's localized pain in the joints, specific muscles as well. So using BPC-157 intramuscularly, just simple injections, either neurotherapy style or IM style, I have helped patients resolve pain that they've been living with for years. Last week, I did this with 2 patients, both of them tears in their eyes, saying, Dr. Parpia, I thought I had to live with pain forever. I got used to this. And all of a sudden, I don't have pain.
Wow.
I don't even know what to do because I don't have pain. I can hardly fathom this. This is from BPC-157 injections.
And was it neuropathic pain, musculoskeletal pain?
Musculoskeletal pain. Okay.
Yeah.
Now, speaking of neurological issues, I do have a patient, many patients who have tick-borne illness. One patient specific, she's starting to develop more neurological symptoms in her Lyme. She'd come off of her IV antibiotics for too long. She moved away and got sicker, started to fall. Okay. And I injected BPC-157 just subcutaneously in the paraspinal muscles. She stopped falling.
Yeah, isn't that amazing? And just last night, I had a good friend over who does exosome products, and he said he was treating this guy, terrible. You hear all these stories where he dove off a boat and there was a rock, 4 feet underneath, and couldn't walk. He couldn't, go to the bathroom, and he combined BPC, TB4, and the exosome, and just subcutaneously, paraspinally, all of a sudden it goes, I can feel my legs, and he said, I have the urge to use the bathroom. He goes, it hasn't happened in years. And it's amazing. Of course, he's been with a neurologist and all these things, and not even going in the joints, And this guy will actually, like, if someone has significant joint pain, or he will guarantee they're significantly better before they leave the room, not the office, the room, or he gives them money back.
I know I couldn't because
it's bold, and he does, basically just subcutaneously. Let's see where the nerves are kind of coming in, and there's actually more studies on TB4, kind of with nerve pain, but I think BPC seems to maybe work better, but there's more studies on TB4, and then ARA290, which I don't know anyone who carries it, but some nice studies on that, on remyelination, or it's like MS, the peptides can be amazing at reversing that. And ALS, it's, ALS is Lyme until proven otherwise. We have ALS patients come in wheelchairs, they're jogging. We send them back to the neurologist, and the neurologist goes, it probably wasn't ALS. Well, 3 of you diagnosed them. And unfortunately, we're going to treat kind of a famous person, and the guy I was talking was going to donate $100,000 worth of stem cells to him, but his doctor said it's not worth it. There's no way that's going to work. Like, okay, you're giving him a death sentence and telling him not to do this. It's just crazy. But yeah, and just the ravage where it's not just the mindset, but when someone's in that position, I guess I can't judge, right? Until you're in that position. You don't want to, making a decision is harder than making a bad decision and living with it.
Yeah. Most of our patients have seen many other doctors before coming to us, of course, without appropriate treatment, without success. So when they come to us, we have these treatments that are new, they are cutting edge.
Or a doctor will say, oh, it's a placebo. Our patients don't react to placebo. They have no SIBO. They don't expect it to work.
Exactly.
So that's true. So it looks like you do a lot of things, and it's something you're doing, like a traumatic brain injury, which is obviously becoming a bigger and bigger problem. And just a quick question, would you let your boy play football?
Probably not.
I don't mean there's kind of no right or wrong. It's just, maybe. You see what's shown to be preventive, right?
I feel like if you love it,
yeah. I think where the big problem comes when they start getting so big and so fast now, that momentum, you know.
Yeah.
But also finally, it doesn't take, you know, major trauma. It's just repetitive trauma. Skateboarders, you know, soccer players, you know, all those things.
Too many of those people come in. That's why when you said football, I thought about the other sports where they get concussions and whiplash very easily. You know, they're more susceptible to tick-borne infection if that were to come.
Yeah, and because I think if someone gets Lyme, they're fine. You know, it's when they get all the other things that now we had. Remember, whole family came in, the nicest family on the cheese farm in the Central California. They're all sick except the dad. And then at that time, which I'm trying to get back, was we had a microscope with immunofluorescent antibodies. And so we're looking at, oh my God, his blood was just full of babesia. And more than anyone else. And he's fine. He wants we have growth hormone. I'm working out now. And it just shows how, you know, because the immune system was high.
Yeah.
But all the other ones were really sick, and where it affected him, he was okay. Yeah. But let's see. So it's how you treat so many things. I'm trying to think. What do you have to do for sleep?
You know, for sleep, I do use a lot of herbs. I do like to use an Ayurvedic sleep medicine if we have to. You know, we'll use medications, but really, if I use herbs and teach them relaxation techniques, and, you know, not using light and internet, electronics at night, usually we can calm it down.
Yeah. And interesting, you know, with all the EMF controversy, and we have our CPA is really big in that, because she's got, everyone in our office is Lyme, that's how we kind of got them, but that she tells everyone. I started telling people, like, just friends of friends, whatever, saying, turn off your Wi-Fi at night. And there was this architect said, I don't believe in that crap. But he did it. And he goes, I slept great for 3 nights. And 4th night, I couldn't sleep. I'm like, oh my God, I didn't turn it off. And he's like, I totally believe it. And wait till we get 5G, you know, and all the problems. And it's interesting. So, you know, doing a deep dive on peptides, where I think most things work through a receptor, but like bipeptides, there's no receptor. They couldn't find a receptor. And this one study showed it was harmonic. So you got this peptide vibrating at a certain frequency, which then stimulated the cell. What if you throw all these EMFs and Wi-Fi? Is that going to work? You know? So we'll see, you know, and it becomes kind of that, you know, fringe, no, you know, EMFs. But also it's shown to cause mold to grow, you know, if they suppress the immune system. But the little cocktail I love for sleep is a combination of delta sleep-inducing peptide, epithalin, and then either growth hormone, AOD, which is a fragment of growth hormone, or growth hormone secretagogue. So many people, it doesn't make you sleepy, but it reduces that inflammation in the sleep center. So it seems like so many problems are inflammation of the hypothalamus. And also right where all the pain centers are, you know. And actually one study where I published that you looked at chronic fatigue syndrome versus fibromyalgia, essentially the same illness. But what they found is that the chronic fatigue syndrome patients had more inflammation in the pituitary, the fibromyalgia more in the hypothalamus, where it kind of ended up the same, but the fibromyalgia patients had more inflammation in the pain center, so they had more of the pain. And it's interesting. And also, adult sleep's great at lowering inflammation, and so it really helps diabetes. That's where it also, inflammation in the hypothalamus causes insulin resistance. And so we just got a text from one of my girlfriends. She sent a couple bottles to her friend, a BPC and TB4 frag, and she lost all this weight. She was like, I love this stuff. And, you know, we didn't even tell her it can do that. But she must have had some insulin resistance, inflammation. And she, you know, sends a picture, and she's so happy. But, so many things, as you know, inflammation.
Inflammation.
No
I
matter
can't wait to
what
use
it is.
the peptides for sleep, because just as I've noticed that peptides make everything else go faster in my treatments, I bet you the sleep ones will too.
Yeah, and it's one of those things, you don't sleep, you don't get better, you don't lose weight. And I'm, do as I say, not as I do too much. I'm up all night and, like, I'll get to start research. Also, the sun's coming up. You're like, what are you doing? You gotta, pop, you gotta get it. But yeah, sleep is key. So that's been something that's been really good. And let's see. So peptides have really helped. And yeah, let's have you back on and do, as we talked about, kind of the sick patients and maybe optimization healthy patients. What, because we tend to talk about the sick of the sick.
Yeah.
But there's so many people that are, I used to have energy. Now I'm just dragging, And I assume you use thyroid and hormones and, and that's kind of was my first passion was thyroid. And that kind of got me through certainly, when I had chronic fatigue syndrome, which ended up being Lyme, but I had chronic fatigue syndrome before it really was chronic fatigue syndrome, which didn't, so my dad had it too, but no one, that wasn't even close. It was just the mystery illness, but our whole family, and that's how I know I grew up with it, but yeah. But you're right, so many people are sick.
So many, and they weren't. It's been very quick that this has happened.
Yeah, and I think it's going to be exponential.
Yeah, I think it has to do with environmental toxicants.
Yeah. I think, stress,
post-COVID syndrome coming up. I'm getting patients now who did have a diagnosis of COVID, who were hospitalized, and now all of a sudden they have tick-borne illness that they didn't have diagnosed before.
Yeah. So wake up the immune system. They tend to have chronic heart inflammation.
Yeah.
Yeah. So they get a lot of palpitations, heart failure. So are they going to be the new chronic fatigue syndrome?
Yeah.
But really at this point, no one should be dying from COVID.
No.
And we keep waiting for this vaccine. What we have now is sufficient to keep 99% of the people, And I don't know if you're the ILADS, I'm scared to talk about COVID. You get a letter from the FTC, but so not saying any cure, just so I'm saying, that there are treatments that just safe if you, give to nursing homes, give them. This is just a suggestion. Because I got a letter too for just putting, with references, about vitamin C and zinc and flavonoids and that. Probiotics. So we had the microbiologist for microbiome laboratories at Megaspore.
Yeah.
Great talk. When I'm talking about, why don't you just go, you have someone give you a grant, go give the probiotics to all the nursing homes. Probably save tons of lives, but they just have to have the $1 million cure at the last minute,
Yeah.
Welcome to America. But don't want to end on a bad note. So, and I think a good basic ending thing, that, patients, they just get so discouraged, right? And I'm sure by the time they see you, many have given up. And I think it's interesting with human nature, people can be empathetic, I think, for about 2 to 3 weeks. And they go, oh, yeah, if you're sick, I'm sorry. Then after 2 weeks, just get out and exercise and, and especially spouses and family members and friends, they lose all their friends. And I think, I won't be sexist, but it seems to be worse for women. They're like, oh, you canceled on my dinner, well, I'm sick. Oh, well, I was sick last week too. I'm tired too, and they just, you can't explain how bad you feel with this.
No, a lot of them are isolated.
Yeah.
By the time they come to people like us, well, we have therapies. for them. Finally,
Yeah.
finally, someone's giving me a diagnosis. Finally, someone has therapies for me. That's what they say.
Yeah. And just want to say we can never guarantee anything,
No.
but odds are good that we can help. And we have published studies to back up. But I tell patients, you're not a study, you're a person. We use the studies to try to figure out what's most likely, what's safest, what's most cost effective, and we do that. But you may respond, 99.9% of people may get better with that, and you may not. But then we keep going forward, And that's a nice thing, is not having the 2-3 treatments, hundreds of treatments, Yeah. So awesome. Thank you so much for taking the time. And we'll have you back on and we'll talk about some healthy patients.
Thank you for having me.
So wonderful. Have a great weekend. And again, thank you so much. Nice pearls in there, and gave people hope. And thank you for that. And keep up the great work.
Thank you for your great work and for interviewing me.
Thanks so much. All right. Bye-bye.
Thanks for joining us on the Peptides and Longevity podcast. If you enjoyed today's episode, don't forget to subscribe, share, and leave a review. It helps us reach more listeners passionate about optimizing their health. For more insights, resources, and updates, visit our website at www.holtorfmed.com. Together, let's embrace a future of health and vitality. Until next time, stay inspired and keep thriving.